I'm Dr. Christy Gibson, and I love to learn about trauma therapies. So, whether you are a patient or client looking for the therapy that's right for you, or you are a psychotherapist trying to figure out what to study, here's some tea. Today, we're going to talk about sensorimotor psychotherapy. So, this is a therapeutic protocol developed by Pat Ogden. And it's kind of interesting branching because from what I've heard, she and Peter Levine had both been studying with Hakomi practitioners, and they branched and they each created a protocol that's a little bit similar. So Peter created somatic experiencing, Pat created sensorimotor psychotherapy, and there are quite a lot of similarities in these two protocols. So when I was trying to decide which to study, I chose Pat Ogden's for a couple of reasons. One was the books that she writes are quite neurobiologically based, and I'm a physician, so that really appealed to me. I really wanted to understand the anatomy and the physiology of what it was that we were doing in this therapy protocol. Another thing that got me excited about sensorimotor psychotherapy was the involvement, like literally the co-authorship of Janina Fisher, who's an excellent trainer in therapy in terms of understanding dissociation and how trauma affects the brain. So the fact that Janina was involved in developing this therapy and writing the original textbook was really exciting for me. One of the things I love about Pat and Janina's approach is that it really talks about trauma reflexes and trauma responses as being more adaptive than maladaptive. So there's a whole chapter 13 on appreciating your strengths, survival, and creative resources. And so it talks about different survival strategies, and some of them we know because they're in the definition of PTSD, like being hypervigilant, kind of startling easy, waiting for something bad to happen. And those traditional PTSD fight, flight, freeze responses. But she also talks about things like staying busy, perfectionism at school or work, excessive physical activity like extreme sports. She talks about dissociating, and different ways that the mind-body system might develop to cope with the trauma that we faced. And she doesn't judge or kind of say this is bad or good. These are just strategies that anybody could adopt. Likewise, she talks about reframing these survival resources. So she says, if you describe this survival resource and then think about this negative thought, emotion, movement, sensations, how do you think of this as a shortcoming? When have you used this survival resource, and how does it help you deal with difficult times? So you're kind of reframing it as like, I've been thinking of this as something wrong with me, but really, how can we think of it as something that's right with me or something that's been helpful at the times that I've needed it? So I really appreciate that approach because my take on trauma is that the reflexes tend to be adaptive, not maladaptive. I was really lucky that I studied sensorimotor psychotherapy. I did the level 1 training only, but one of the things that really helped me hone in on as a practitioner is tracking. So tracking physical cues, whether it's posture, whether it's breath or breath holding, whether it's eye movements, tension in the body, movements across the face. I really developed a lot of skills with tracking because of what I learned in this level 1 training. She really encourages the development of the existing resources and finding new ones, whether those are creative resources, whether these are grounding resources, getting you physically present in your body, whether these are some of your survival strategies that can be adapted in a way that they are achieving your goals in a new way. So one of my favorite exercises that I've learned with that training program was, how can you actually embody a boundary? So we would take an object that either reminds you of the person that you're working on this boundary with, and you would use neuroception. So how does your body warn you that you're feeling like you're not as safe? You would use that ability to see how close this object should be. Should it be out the door and around the corner? Should it be across the room? Should it be right in your lap? and really tracking your own physical sensations to decide where you need that boundary to be. So of course, obviously, it's not like the person is going to be 4 feet away and stay there, but you kind of get this idea of like, do I want them close? Do I need them far away? And that's so helpful. And it's kind of like using your instincts and tracking them, and allowing that to tell the story of what your body already knows. Another similar thing with both somatic experiencing and sensorimotor psychotherapy is this idea that something got kind of frozen that wanted to enact itself at the time of the trauma, whether that was an event that you needed to run away from or fight off, so the fight and flight response, or whether it's something that you shut down and you just didn't do the action at all. So there's this thing that kind of got stuck at the time of trauma. This can be both event and relational trauma, but in my experience, I find it more useful in an event-based context, because with relational trauma, it's kind of rare that you want to, beat up your caregiver. There might be a dissociative response that still has something locked in that wants to enact. But a lot of times when we were doing the sensorimotor psychotherapy protocol with each other, we would do things like pushing away with a pillow, moving our feet. So we were more enacting fight and flight responses generally. So these are kind of called acts of completion, and you can guide your person through this act of completion so that their body feels satisfied. Yes, I've done this thing. It's not locked in wanting to constantly do it. It's interesting in that she also talks about sequencing, which is the discharge of the tension that's being held in the tissues. So I've studied tremoring therapy, which I'll get into in a different video, but I think they're actually quite related. So she talks about it being a manifestation of energy that wasn't discharged. So it can manifest in the body as restlessness, and once the sequencing has happened, when you've pulled the thread on the traumatic event, the sequencing allows the body to release the tension that's been held ever since. A lot of the work of the patient or client in sensorimotor psychotherapy tends to be tracking their own sensations and emotions and the parts of the body that are undergoing processes related to experiencing the trauma and the associations. So it's really creating a lot of mindful awareness. And I always think of trauma resolution. Some of these first steps are just noticing what's happening, because so much of it has become a reflex, is happening under conscious awareness. And once you bring those processes into awareness, there's so much more flexible and adaptable responses that are available. Personally, the way that I use SP now is I integrate it with other therapeutic modalities that I use. So sometimes if a person isn't very adept at imagining, I might have them move their body during a session instead of trying to imagine a way to release tension. So we might physically do an act of completion instead of using a metaphor or something like that. So I might integrate it with something like accelerated resolution therapy. Sensorimotor psychotherapy can be really beneficial for folks who have trauma that's stuck in the body and you even know where that might be. It can be a really efficacious way to release that. It can also be really helpful in relational trauma because she's designed some protocols around reaching out and the way that we might embody that reach. So not just boundaries, but also connection. So whether you are a client or patient looking for a therapy or somebody who's interested in studying different therapeutic modalities, I hope this brief chat about sensorimotor psychotherapy was helpful.